we are going to look at the anti-arrhythmic drugs. So to start off with, we are going to ask some questions. So the first question is, name some class 1 drugs. Name some class 1A drugs. So name the drugs as well as give their mechanism of action. This will be the first question. The second question will be, name the class 1C drugs and what are their mechanism of action. The third question will be, name the class 3 drugs. Class 3 drugs as well as what is their mechanism of action. So by the end of this video, you will know the answers to all these questions. And in the end, there is also some bonus questions which will be asked. To start off with, firstly, we need to know the action potential diagram. So it goes down, it peaks, then there's a plateau formation, then it again dips. So now looking at the phase, so this is 4, so this is 0, 1, 2 and 3. So here we are just going to, in brief, mentioning the name of the class. So class 1 acts here. So this is nothing but the sodium. The sodium, it goes inward. Next we are looking at class 4. So class 4, so before that we are looking at the ion. So at peak what happens? The potassium as well as the chloride. Okay, the potassium and the chloride, it goes out. So then in class 4 what happens is it acts on the calcium. So this plateau is where the calcium it goes in. Next we look at the potassium. If you see the potassium, it goes out. Then there is a potassium which is the rectifier. So we saw the class 4, it acts on the calcium, that is calcium going in, and then class 3 it acts on the potassium going out. So this is nothing but the class 3. Later we also have the potassium rectifier. So potassium rectifier, here it's nothing but the class 2 which acts on them. So this diagram is very important to know. Now we are going to go in detail about the classes, the examples, the mechanism as well as the role on the action potential. So now we are going to start with class 1. So what is class 1? Class 1, we have class 1A. So 1A, the examples include the procainamide. The procainamide. There is also the quinidine. There is quinidine as well as the disopyramide. So what are the examples, the mechanism of action of these drugs? So the mechanism of action is that, firstly, the sodium channel blockers. There are sodium channel blockers. So they are with a significant potassium channel. So they have with a significant potassium channel blocking property. They have a potassium channel blocking property. So what is the effect on the action potential duration? So looking at the action potential, it is nothing but it is prolonged. Then we move on to the class 1B. What is class 1B? 1B, it includes the lidocaine. It includes lidocaine as well as the mexiletine. Okay, lidocaine as well as the mexiletine. And the mechanism of action is that there is a sodium. There is sodium channel blockers. There is sodium channel blockers, and this is along with the potassium channel opening property. So it blocks the sodium as well as the potassium opening property is present. So what is the effect on the action potential duration? So here we are going to learn that. So the effect on the action potential duration is that it is shortened. The action potential duration, if you see, it is shortened as well as there is no effect. Then we are moving on to the 1C class. So what is the 1C? The 1C, it includes the drugs such as the flecainide, propafenone as well as the moricizine. So they are the drugs which fall under the 1C category. So what they do is that the sodium channel, they are the sodium channel blockers, and they have a negligible potassium channel blocking property. So they have a negligible potassium channel blocking property. So what about the action potential effect? So action potential duration is that it is variable or there is no effect. Then what we move on is a class 2. So what is a class 2? The class 2, it includes the propranolol, propranolol as well as the esmolol. So as we know, they are nothing but the beta blockers. Then we jump on to the class 3. So what does this class 3 include? So class 3, it includes, there is a amiodarone, then there is also the tronidarone. Next, it also includes the dofetilide, sotalol, ibutilide, the vernacalant. So what we need to know is that all this is, they are potassium channel blockers. They are all potassium channel blockers. So what about the action potential? The action potential here, it is nothing but it is prolonged. Then we move on to the class 4. So what is this class 4? So class 4, it includes the verapamil and the diltiazem. So verapamil and diltiazem, they are class 4, and what they do is they block calcium. They are calcium channel blockers. So all this will be easier if you know the diagram which we mentioned in the first. So then we look at some miscellaneous antiarrhythmic drugs. So this includes, there is the adenosine. Start off with adenosine. So adenosine, what it does, it activate the adenosine receptor. And what about the action potential? The action potential is shortened. Action potential is shortened. Then we move on to the thing called digoxin, the drug digoxin. So what does this digoxin do? So digoxin, if you see, it is nothing but a sodium potassium ATPase. It is sodium potassium ATPase inhibitor. Okay. And what about the action potential duration? So the action potential is nothing but it increases the AV node refractoriness. And then we look at the magnesium. So magnesium, it is totally unknown. So now we are going to go back to answering our question. So the questions we asked, the first question we asked was, what are class 1A drugs? The class 1A drugs, it includes, there is the procainamide. There is procainamide. There is also the quinidine and the disopyramide. So they are nothing but the class 1A drugs. So what was the mechanism of action? The mechanism of action is that they are sodium channel. They are the sodium channel blockers. And what it does, there is a significant potassium channel blocking property. There is significant potassium channel blocking property in case of the class 1A. So what about the AP duration? Action potential duration is that it is prolonged. So this was the first question we saw. Then moving on to the question number 2. So in case of the second question, here we asked what is a 1C drugs. What is the class 1C drugs, mechanism of action, and the role of the action potential? So here the drugs it includes, there is the flecainide, propafenone, as well as the moricizine. So they are the drugs. So here the mechanism is that they are the sodium channel blockers, and they have negligible potassium channel blocking property plus a negligible potassium channel blocking property. Then what we look at, the action potential duration. The action potential duration is nothing but it is variable. It is variable as well as there is no effect. Now moving on to the last question. Last question we asked was, what about type 3? So type 3. What is type 3? What are the drugs, the mechanism, and the role of the action potential duration? So class 3, it includes the amiodarone, dronidarone. Then it also includes the dofetilide, the sotalol. Next, it includes the ibutilide and the vernaculant. So it includes all this. So they are nothing but the potassium channel blockers. And then what about its action potential duration? So the action potential duration is that it is prolonged. So now we are going to look at some bonus questions. So looking at the bonus questions. So the first question will be, you can answer these in the comments. First question is, name class 2 drugs plus the mechanism of action and the action potential, whether it's prolonged or shortened. So first one is class 1, 2 drugs. Second one will be, what are the class 4 drugs? What are class 4 drugs? Same thing, that is a mechanism as well as we want the action potential, whether it's increasing or decreasing. Then thirdly, we want to know the role of digoxin. So what is this drug? Why is it special? We need to know what is a digoxin drug. So what is its mechanism as well as the role in the action potential. So you can answer these questions in the comments.